Hello everyone, and welcome back to my channel. Thank you for joining us today. We're excited to explore an intriguing topic in the realm of human anatomy, horseshoe kidneys and the fascinating insights surrounding their awareness. A horseshoe kidney is a congenital condition where the two kidneys are fused together at their lower ends, forming a U-shape reminiscent of a horseshoe. This anomaly affects about 1 in 500 individuals and can have various impacts on kidney function and overall health. What's particularly captivating is the idea of consciousness related to the horseshoe kidney. While the kidneys themselves do not possess consciousness in the way we understand it, being aware or having thoughts, there has been increasing interest in how variations in kidney structure may influence our overall well-being, including physical health and even emotional state. Throughout our discussion, we'll delve into the anatomical significance of horseshoe kidneys, their potential health implications, and touch upon the broader idea of how our bodily structures can interact with our quality of life. Let's embark on this exploration together. Horseshoe kidney is a congenital condition where the two kidneys are fused together at their lower ends, forming a U-shape or horseshoe appearance. This fusion typically occurs during fetal development. While most people with a horseshoe kidney have normal kidney function, the condition can sometimes lead to health issues, such as 1. Urinary tract infections. UTIs. The altered shape can disrupt normal urine flow, making infections more likely. 2. Kidney stones. Stasis of urine in the fused kidney can increase the risk of stone formation. 3. Hydronephrosis. Obstruction of urine flow can cause swelling in the kidneys. 4. Vesicoureteral reflux. Urine may flow backward from the bladder into the kidneys. 5. Increased risk for certain conditions. Rarely, it may be associated with other congenital abnormalities or syndromes. Treatment depends on symptoms. Many individuals remain asymptomatic and require no intervention, but if complications arise, treatment may involve managing infections, addressing obstructions, or removing kidney stones. Regular medical follow-ups are recommended for monitoring. Causes of horseshoe kidney. Horseshoe kidney is a congenital condition, meaning it occurs during fetal development in the womb. The exact cause is not always known, but contributing factors may include 1. Genetic influences. It may occur sporadically or as part of certain genetic syndromes, such as Turner syndrome or trisomy 18, Edwards syndrome. 2. Abnormal fetal development. During weeks 4 to 8 of gestation, the kidneys fail to separate and move to their typical position on opposite sides of the body. Instead, they fuse at their lower poles. 3. Environmental factors. Rarely, external factors during pregnancy, e.g., maternal drug use or exposure to toxins, might influence fetal kidney development. Symptoms of horseshoe kidney. Many people with a horseshoe kidney have no symptoms and discover the condition incidentally. However, some may experience symptoms, particularly if complications occur. These can include 1. Pain. Abdominal, back, or flank pain, especially if caused by kidney stones or hydronephrosis, swelling of the kidneys. 2. Urinary symptoms. Frequent urinary tract infections, UTIs. Painful or burning urination. Cloudy or foul-smelling urine. 3. Kidney stones. Symptoms of stones, such as severe pain, nausea, or blood in the urine, hematuria. 4. Hydronephrosis. Swelling due to obstruction of urine flow, which may cause discomfort or infection. 5. Other symptoms. Fatigue, fever, or chills if an infection is present. Blood in the urine. Rarely, difficulty in controlling urination, incontinence. When to see a doctor. Seek medical advice if you experience recurrent UTIs, severe abdominal or flank pain, blood in your urine, difficulty urinating or other urinary problems. Regular checkups and imaging tests, e.g., ultrasound, CT scan, can help monitor kidney function and detect potential complications early. Horseshoe kidney is not typically hereditary in the strict sense, meaning it does not usually run directly in families. However, it can sometimes be associated with genetic or chromosomal disorders that may have a hereditary component. For example, when it may have a genetic link. 1. Syndromic associations. Horseshoe kidney can occur as part of certain genetic syndromes, such as Turner syndrome, a condition affecting females, caused by a missing or partially missing X chromosome. Trisomy 13, 18, or 21, chromosomal abnormalities like Down syndrome. In these cases, the condition is related to the underlying genetic disorder rather than being directly inherited. 2. Familial cases, rare. In rare instances, there may be a familial pattern suggesting a genetic predisposition, but this is uncommon. Sporadic nature. In most cases, horseshoe kidney occurs sporadically, meaning it happens by chance during fetal development and is not inherited from the parents. If there is concern about a genetic link or a family history of kidney abnormalities, consulting a genetic counselor can provide more insights. Horseshoe kidney is not inherently a serious condition for most individuals, as many people with it live normal, healthy lives without significant issues. However, its seriousness depends on whether complications develop. Here's an overview. When it's not serious. Asymptomatic cases. Many individuals have no symptoms and discover the condition incidentally during imaging tests for other reasons. Normal kidney function. Most people maintain good kidney function, even with the abnormal anatomy. When it can be serious. Complications. Some people experience problems that may require medical attention, including urinary tract infections, UTIs, recurrent infections due to urine flow disruption. Kidney stones, increased risk due to altered kidney anatomy. Hydronephrosis, swelling of the kidneys due to obstruction of urine flow. Vesicoureteral reflux, backward flow of urine into the kidneys, potentially leading to infections or kidney damage. Associated conditions. In rare cases, horseshoe kidney is linked to genetic syndromes or other congenital abnormalities that can affect overall health. Management. Horseshoe kidney is usually manageable with regular monitoring and treatment of any complications. Common approaches include 1. Lifestyle adjustments. Stay hydrated to reduce the risk of kidney stones. Maintain good hygiene to prevent UTIs. 2. Medical monitoring. Regular checkups with a healthcare provider, including imaging tests, e.g., ultrasound, CT scan. Monitoring kidney function through blood and urine tests. 3. Treatment for complications. UTIs, antibiotics to treat infections. Kidney stones, medical or surgical removal if necessary. Obstruction, surgical correction for severe cases of hydronephrosis or obstruction. Prognosis. Most people with horseshoe kidney lead normal lives with minimal impact on their health, especially with early detection and proper management of complications. Regular medical follow-ups are key to preventing or addressing any issues. Yes, horseshoe kidney can lead to long-term complications in some individuals, although many people live without significant issues. The likelihood and severity of complications depend on the presence of associated conditions, the anatomy of the kidneys, and how well the condition is managed. Potential long-term complications. 1. Kidney function impairment. In some cases, the abnormal structure of the kidneys may lead to reduced kidney function over time, especially if complications like infections or obstructions occur frequently. 2. Urinary tract infections, UTIs. Recurrent infections due to altered urine flow can lead to scarring of the kidneys and, in severe cases, chronic kidney disease, CKD. 3. Kidney stones. People with horseshoe kidney have a higher risk of stone formation due to urine stasis. Persistent stones may lead to pain, infections, or kidney damage if untreated. 4. Hydronephrosis. Obstruction in the urinary tract can cause swelling of the kidneys. If untreated, This can damage kidney tissue and lead to long-term complications like CKD. 5. Vesicoureteral reflux, VUR. Backward flow of urine into the kidneys can increase the risk of infections and kidney damage over time. 6. Hypertension, high blood pressure. Kidney abnormalities can sometimes affect blood pressure regulation, leading to long-term hypertension. 7. Increased risk of renal cancer, rare. Very rarely, individuals with horseshoe kidney may have a slightly elevated risk of developing kidney tumors, though this is uncommon. 8. Associated congenital or genetic conditions. If horseshoe kidney occurs as part of a syndrome, e.g., Turner syndrome, other health issues related to the syndrome may contribute to long-term complications. Preventing long-term complications. Regular monitoring, routine checkups with a healthcare provider, including imaging and kidney function tests, can help catch complications early. Healthy lifestyle. Stay well hydrated to prevent kidney stones. Maintain a balanced diet and healthy weight. Avoid excessive salt to reduce the risk of hypertension. Prompt treatment of infections. Treat UTIs promptly to prevent kidney damage. Specialist care. Consult a nephrologist, kidney specialist, for ongoing management if complications arise. Prognosis. With proper monitoring and early intervention, most long-term complications can be managed effectively, allowing individuals with horseshoe kidney to lead healthy lives. Horseshoe kidney can affect fertility in women in some cases, but it is generally not a significant barrier to conceiving or carrying a pregnancy. The impact depends on the presence of associated complications or congenital abnormalities that might coexist with the condition. How horseshoe kidney might affect fertility and pregnancy. 1. Associated uterine abnormalities. Horseshoe kidney can sometimes occur alongside congenital abnormalities of the reproductive system, such as a bicornuate uterus or uterine agenesis, which may impact fertility or pregnancy outcomes. These abnormalities arise because the kidneys and reproductive organs develop from the same embryonic tissue. 2. Risk of recurrent urinary tract infections, UTIs. Frequent UTIs, common in women with horseshoe kidney, can potentially affect fertility by causing inflammation or scarring in the pelvic region. 3. Complications during pregnancy. Women with horseshoe kidney may have a slightly higher risk of complications during pregnancy, such as hydronephrosis. Pregnancy can increase pressure on the urinary system, exacerbating existing kidney drainage issues. Preeclampsia. High blood pressure is more common in women with kidney abnormalities. Preterm birth or low birth weight, due to associated conditions or complications. 4. Impact on menstrual cycles. While uncommon, if there are coexisting reproductive anomalies, it might lead to irregular menstrual cycles, potentially affecting ovulation and fertility. Fertility outlook and management. Most women with horseshoe kidney can conceive and carry a pregnancy successfully. To ensure the best outcomes. 1. Preconception planning. Consult with a healthcare provider or specialist, e.g., nephrologist or obstetrician, before trying to conceive. Undergo imaging tests to evaluate the anatomy of the kidneys and reproductive organs. 2. Managing complications. Treat and manage UTIs promptly. Monitor blood pressure and kidney function regularly, especially during pregnancy. 3. Specialist care during pregnancy. Pregnancy in women with horseshoe kidney is considered high risk. Close monitoring by a maternal fetal medicine specialist can help identify and manage any complications. 4. Healthy lifestyle. Stay well hydrated, eat a balanced diet, and maintain a healthy weight to support both kidney and reproductive health. Conclusion. Horseshoe kidney may pose some challenges related to fertility and pregnancy, especially if other anomalies or complications are present. However, with proper medical care and monitoring, most women with this condition can have healthy pregnancies. Medical precautions and treatment for horseshoe kidney depend on whether the condition is asymptomatic or if complications such as infections, kidney stones, or urinary obstructions arise. Below is an overview of the general precautions and medications commonly used. Medical precautions. 1. Regular monitoring. Routine kidney function tests, e.g., blood tests like creatinine and urea, and urine tests for protein or blood. Imaging studies such as ultrasound, CT, or MRI to check for kidney stones, hydronephrosis, or other abnormalities. 2. Hydration. Staying well hydrated helps prevent kidney stones and reduces the risk of urinary tract infections, UTIs. 3. Dietary modifications. Low sodium diet to manage blood pressure. Avoid excessive protein intake, which may strain the kidneys. Limit foods high in oxalates, e.g., spinach, nuts, to reduce kidney stone risk. 4. Infection prevention. Practice good hygiene to avoid UTIs. Empty the bladder regularly to reduce urinary stasis. 5. Pregnancy monitoring. If you're pregnant, ensure regular monitoring by a high-risk obstetrician. 6. Avoid nephrotoxic substances. Minimize the use of medications or substances that may harm the kidneys, e.g., NSAIDs, certain antibiotics, or contrast dyes. Treatment with medicines. 1. For urinary tract infections, UTIs. Antibiotics. Examples: nitrofurantoin, trimethoprim sulfamethoxazole, ciprofloxacin. Used to treat bacterial infections. Choice depends on the type of bacteria and patient factors like pregnancy. Pain relievers. Acetaminophen, paracetamol, for pain or fever. Avoid NSAIDs like ibuprofen if kidney function is compromised. 2. For kidney stones. Pain management. Medications such as diclofenac or acetaminophen for pain relief during stone passage. Stone dissolution or prevention. Potassium citrate, to alkalinize the urine and dissolve certain types of stones. Thiazide diuretics for calcium stones, if recommended by a nephrologist. 3. For hydronephrosis, swelling in the kidneys. Treat the underlying cause, e.g., obstruction or infection. In severe cases, surgical intervention may be needed. 4. For high blood pressure, hypertension. Antihypertensives. Examples: ACE inhibitors, lisinopril, enalapril, or ARBs, losartan, are commonly used if blood pressure is elevated. 5. For vesicoureteral reflux, VUR. Prophylactic antibiotics, low-dose antibiotics to prevent recurrent infections. 6. For pain management. Mild pain relievers like acetaminophen are safe in most cases. Avoid NSAIDs unless approved by a doctor. When to seek specialist treatment. Recurrent UTIs, kidney stones, or severe pain. Chronic kidney disease, CKD. A nephrologist can manage declining kidney function. Structural abnormalities, urologists or surgeons may correct obstructions or severe hydronephrosis. Conclusion. Most cases of horseshoe kidney can be managed with regular monitoring, lifestyle changes, and prompt treatment of complications. Medications are tailored to address specific issues like infections, pain, or kidney stones. Early detection and proactive care are key to preventing long-term complications. In the video, we discussed several key points about horseshoe kidney, including 1. What horseshoe kidney is. We explained that horseshoe kidney is a condition where the two kidneys are fused together at the lower end, forming a U shape. 2. Causes and development. We covered how horseshoe kidney typically occurs during fetal development and its potential genetic and environmental factors. 3. Symptoms and diagnosis. We highlighted the common symptoms associated with the condition, which can include abdominal pain or urinary issues, and the methods used for diagnosis, such as imaging techniques. 4. Potential complications. We talked about the possible complications, such as increased risk of kidney stones, urinary tract infections, and other renal issues. 5. Management and treatment. We discussed different management strategies, including lifestyle changes, monitoring, and in some cases, surgical options. We encourage you to share your experiences or stories related to horseshoe kidney in the comments below. Your insights can help others who may be going through similar situations. If you enjoyed this content, please like, share, and subscribe for more informative videos. Thank you for watching.